What do you mean by the antihypertensive agent? Antihypertensive means used to treat the high blood pressure. What do you mean by the first one? Hypertension. To reduce elevated blood pressure. The normal blood pressure is 120 to 80 mmHg. In the hypertension, they are the elevated by systolic to diastolic. In the systolic is the 122 mmHg. In the diastolic, they are the 80 mmHg. In the mild hypertension, moderate hypertension, and the severe hypertension. In the first one, mild hypertension, the when diastolic pressure is 90 to 104 mmHg, then it is the mild hypertension. When diastolic pressure is 105 to 114 mmHg, then it is the moderate hypertension. Severe hypertension, they above the 115 mmHg, it is called as the severe. Types of the hypertension, there are the two types: primary hypertension and secondary hypertension. In the primary hypertension, it is also known as the essential hypertension. In primary hypertension, the causes are the not known. In the secondary hypertension, causes are known. Okay, then suppose your suppose blood pressure is reduce 140 mmHg to systolic pressure, and they are the less 90 mmHg, they are the dystolic blood pressure. The classification of and the antihypertensive agent, there are the four types. They are the classify A, B, C and D. A means AC inhibitor, means angiotensin converting enzyme inhibitor. Then angiotensin second receptor blocker and alpha blocker. Then first one, angiotensin converting enzyme inhibitor means AC. The example of the AC inhibitor, first one, captopril, enalapril, lisinopril, fosinopril. Next one, angiotensin second receptor blocker, first one, losartan, telmisartan, candesartan. Next one, alpha blocker. Then alpha blocker can be divided into suppose two type: non-selective alpha blocker and selective alpha blocker. In a non-selective alpha blocker, example is phenoxybenzenamine and phentylamine. In the selective alpha 1 blocker, prazosin, terazosin, doxyzosin. Next part is B. B means beta blocker, and both alpha and beta blocker. In an beta blocker, they are classified in two types: non-selective beta blocker and the selective beta blocker. In non-selective example, propanolol. Selective मध्ये atenolol, metoprolol. Both alpha and beta blocker, labetalol, carvedilol. Next one, C. C means calcium channel blocker and central sympathomimetic. In next to calcium channel blocker, for the example is nifedipine, amlodipine, felodipine. In the central sympathomimetic example, clonidine, alpha methyl-dopa. Then next, diuretic. What do you mean by the diuretic? Suppose thiazides, potassium sparing diuretic and the loop diuretic. First one is the thiazide. Example of the thiazide, chlorothiazide, potassium sparing diuretics, spironolactone, and loop diuretic, furosemide. Then direct vasodilator, arterial and both arterial and the venous. First one example is hydralazine minoxidil, and both arterial and the venous, sodium nitroprusside.